Hello guys, welcome to my presentation. Myself Ajin Shah. Today in this presentation we can see the continuation of shortwave diathermy. Okay, first let's see about production of shortwave diathermy. Here the system consists of two circuits. One is the mission circuit and the patient circuit. First, mission circuit. The mission circuit is also known as oscillatory circuit, which consists of condenser and an inductance. Here the currents of different frequencies are obtained by selecting suitable condenser and inductance. If a current of high frequency is required, the condenser and inductance are very small. While to produce a current of lower frequency, a larger condenser and inductance is used. Second one is the patient circuit, which is also known as resonator circuit or cable wire method. Here the mission circuit is coupled with the patient circuit, which converts the electrical energy into electromagnetic energy which produce eddy current. As we can see about methods of application. Here we use two methods, condenser field method and cable method. Okay, let's see briefly about condenser field method. In condenser field method, there are four types: contraplanar method, coplanar method, crosswire method and monopolar method. First, contraplanar method. It is used to treat the structure on the two aspects of the body. Here, two electrodes are placed on opposite sides of the part being treated. For example, in joints such as shoulder joint, knee joint, ankle joint, etc. Next one is coplanar method. It is used to treat the structure on one aspect of the body. Here, the two electrodes are placed on the same line together of the part being treated. For example, in spine. Here, the distance between the electrodes must be greater than sum of skin electrode distance. Otherwise, the line of force passes between the electrodes rather than through the tissue. Next one is crosswire method. Here the position of electrode is like contraplanar technique, but half of the treatment time the electrodes are placed anterior and posterior to the treated area, and the second half of time the electrodes are repositioned and kept lateral and medial to the treated area. For example, in knee joint. Next one is monopolar method. Here the active electrode is placed over the site of lesion, while the indifferent one is applied to some distant part of the body. This method is used for very superficial lesions such as face and sinuses. Next we can see briefly about cable method, or it is known as induthermy. In this method, a thick insulated cable is used for treatment purposes. Here the electric field or magnetic field or both are achieved by the use of cable method. When the high frequency current oscillates in the cable, a varying electrostatic field is set up between its ends and a varying magnetic field around its center. The cable is coiled around the patient's body and is separated from the patient's body by a layer of insulating material. The eddy current produces heat and their effect confines only to the tissues of low impedance. Thus, heating of fat and white fibrous tissue is avoided. The currents are produced primarily near the surface of the conductor, where the magnetic field is strongest and the superficial tissues are heated most. Some heat is transferred to adjacent tissues by conduction and by the circulation of blood, but the heating effect is primarily on superficial tissues of low impedance. Next we can see the advantages of cable method. The cable method is useful for the treatment of an extensive area which could not be included between the condenser electrodes. And when the area is irregular, this cable method is very useful. And when it is desirable to avoid heating of the subcutaneous fat, this cable method is very useful. When we see about disadvantages of cable method, the impossibility of using air spacing is a main disadvantage. Here, the main benefit of using monode electrode is that it uses air spacing, which works on the principle of a cable. Next, we can see the dosage. The treatment dosage should have an intensity that causes sufficient warmth of the tissues, and the duration of the treatment should be 20 to 30 minutes. The treatment may be given daily or on an alternate day. As a general rule, for the treatment of acute inflammation or any recent injury, the intensity of the treatment should be less, but it should be carried out more frequently, that is, twice daily. The current used may be that which produces mild warmth, and may be reduced to the point at which no warmth is felt, so that the duration of treatment is reduced to 5 to 10 minutes. Okay guys, we can see the continuation in the next video. Thank you all for listening to my presentation.